hospitals under the banner of Shankara Foundation India. So we have a network of 49 hospitals, and shortly will be 50 spread across the country. But what is important is we started off as a two-room medical center in the heart of a city called Coimbatore. Our founders, Dr. Ramni and Dr. Radha Ramni, have given their time and their lives totally to the benefit of the society. So they wanted to do something beyond their private practice, and that's how they established the medical center. And today, like I mentioned, 49 hospitals, and on an average, we do close to 250,000 free eye surgeries every year. And so far, with divine blessings, we've been able to do reach out to more than 2.5 million and performing 2.5 million free eye surgeries all through our systems. Again, I was thinking, as being part of this, healthcare summit, what is the commonality, or where do we sort of align, or where do we see the common picture? Today, I got myself, very convinced that we've been fortunate to have lived at the time when living saints have lived. So I think that's the common situation between Shankara and all the Sai institutes, that we have lived. We've been fortunate to live through that time. We've seen the living saints live the godly life and teach us to do more, to do better. So I think that's the common link that as organizations working to serve have to realize, and we need to go forward. I would just like to emphasize on two innovations that at Shankara, again, with the grace of God, we've been able to deliver. One is called as service. It's an acronym for Shankara Electronic Remote Vision Information System. And this is a handheld device which each of the field workers carry along with them to do door-to-door service. Now, what is the benefit that this gives us? We get a sort of a view of the community as to where the prevalence of disease is, because these are all lat-long enabled. So we have geotagging in that, and we are able to ensure that we get a certain level of insights of the prevalence or the pattern of diseases, so that then we can go ahead and reach out to them. So this is how we have enabled technology, and technology has in fact enabled us to do more, to reach out more, and make our intervention more scientific, make our intervention more data-driven, and also enabled us to hold on to a lot of insights and evidences that we can then subsequently take back to the government and advocate, hey, there is so much of blindness in this region. Can we work together and do something better? So technology has been extremely key and important for us to scale. We do work across 11 states in the country, and across the 11 states, we are able to capture this information. And we believe that data is going to be a huge wealth going forward, so that then organizations like ours in the service sector can do more to people who really deserve. So this is one intervention that I wanted to highlight. The other intervention is from a patient experience perspective. This is called as Sahai, which is an acronym for Shankara Health to AI. So what we did was, once the AI started coming in, we started looking at alternates and see how best we can capture the patient experience. We started off with handheld forms. I'm sure all of you have done that in working in hospitals. Handheld forms. Then we moved to tablets where the patients would enter information and insights. But we really wanted to hear the voice of the patient. So that's when we ventured into the Sahai, where it captures the voice of the patient directly from through their mobile phones. And through AI, we've used multiple language modeling solutions, and we're able to capture 15 unique languages as well. So any dialect, any the Tamil spoken in Chennai is different from Tamil spoken in Coimbatore. We still are able to use AI to manage and hear out the insights from there. And the best part is, assuming that the patient comes in and says, hey, your canteen was excellent, but the waiting time at the optometrist was way too high. So this, again, using AI, this insights in the local language, the patient has mentioned that this will go to the concerned heads of each of these departments. The optometric head also will get an information. The canteen also will get an information. Hey, you have a positive emotion through a patient today for the canteen, and that the optometrist head will receive a negative emotion. Hey, there is somebody who said that your waiting time is bad. So it is the responsibility of the head of the department. Automatically a ticket will get raised, and it's the responsibility of the head of department to close the ticket, to close the phone. So that's how we've been able to utilize technology And we also track the number of recurring insights. So yesterday there was an optometry waiting time issue, and today again there is an optometry waiting time issue. While the head has said now we have closed the loop, that is the recurring issue is again brought back for review and discussions. So this is just a very bird's level eye view for how we can use technology to reach out to the doorstep of rural India. So these two are our interventions. The third is also something related to Sahai, where we now look at, we are now a 3,500 employee-based organization. My wife here heads the group for HR as well. So we have brought in the same concept to performance review. So based on earlier it used to be handheld, and the reviewer would make notes and things like that. Now we are able to capture the emotions of the person who is being reviewed as well as the person who is reviewing to see the quality of insights. Is the reviewer giving the right sense to the person who's being reviewed, not being feeling threatened by evaluations and things like that. So we are trying to utilize this insights and see how best we can work. And in the early morning session, some speakers mentioned how God's work will attract the right people. And we've been fortunate, and we realized every single moment of our lives that even this, when Sahai was born, it actually came, the idea came from a patient who visited a Hyderabad hospital. The consultant connected me saying, Bharath, this guy seems to have some idea, but he doesn't have a software or solution, but he wants to talk. So we just heard him out. We just heard him that there's a broad concept of how we could use voice-based. We were looking at something for customer feedback. So this both fitted in. So we strongly believe, and I can vouch for anything and everything on that front, that good work will have good people follow us. So ensure that we keep continuing the good work that he has given us the responsibility of. More and more good people will follow us. More and more good people will join us and enable us to reach out to more people. So that's my insight. Thank you very much, Dr. Sundesh, for the opportunity and the invitation. And wish you all.